Well, here I am on a holiday abroad, and it just kind of, as I'm walking around the countryside here, it kind of brought a question to my mind of what to put in a first aid kit really when you're travelling. So I have brought a first aid kit here with me on holiday, and what I have in that will be completely different to what I would carry around in the classroom with me when I'm teaching you guys first aid skills. Because a workplace first aid kit is going to be used on somebody else. You'll use it as an employee to help your employees or any other customers possibly that might come into your workplace. So you have to be really careful with what you put inside a workplace first aid kit. It always has to be fit for your purpose. There should be no lotions, no potions, no sprays. In other words, nothing that can hurt somebody inside a workplace first aid kit. Whereas when I'm on holiday, my first aid kit would generally be for me to be able to use, but also I might need to use it in an emergency to be able to treat somebody else. But I must remember, if I am treating somebody else, I don't want to be giving them anything where potentially they might have a severe allergy to. So I would never give them any medication because I'm not a doctor, I'm not there to prescribe it to anybody. And I definitely don't want to be rubbing any creams or lotions onto anybody. So when preparing and packing your holiday first aid kit, it's going to be specific for you. A bit like your workplace one is specific for your workplace. Your holiday one is going to be specific for you. You know, who are you going with? Are you going with family and friends? Do you need to take more things than just for yourself? Where you're going? You know, have you got access to medical supplies if you went to that country and forgot anything? Or are you going somewhere quite rural? Are you going off the grid? Are you camping? Then you need to adjust what you put in there to suit the environment of where you are. But for myself, I've got all the usual things, but I've also added a few extras in there. So I've put some paracetamol in there, because sometimes I get a headache. I've also put some ibuprofen in there, just in case I get any muscle soreness. And I'm also going to be taking away some afterbite. And antihistamines I find quite useful as well, because I'm always getting bitten by mosquitoes or something that irritates me. Now with bites and stings, you have to be careful because you need to know kind of what it is that's bitten you and stung you. If it is a sting, you need to remove the sting safely. You need to be able to clean the wound out. You also need to put a cold compress on there, which is going to reduce any swelling. And then if it is going to be itchy a bit later on, then that's probably when I want to put on my antihistamine cream or maybe my afterbite little stick that I've got. Because if I itch it, it's going to leave an open wound, and that open wound can then get infected. So we do have to be careful with things like bites and stings. But also, because in a foreign country, you don't really know what it is that maybe bitten you or stung you. It's not like being in the UK. So if you are concerned, and I have done it once to a friend, she had a snake bite. We didn't realise it was, but she had a big swelling, which we just thought was a mosquito bite. So we kind of just drew a kind of a pen mark around it. And if it grew, we knew it was something to be worried about. So we went to the actual local doctors, as her snake bite unfortunately did travel up her leg. So advice would be just keeping an eye on that bite or that sting, and just to see if it just changes any colour, if it changes its appearance, and if it moves, because that is something where you might need to go and seek medical help about as well quite quickly. So I've got those in there, but I also might carry around as well some Diarrhea because of the sunshine. If you're out too long in the sunshine, you might get dehydrated, and I want to be able to hydrate myself quite quickly. So that's quite useful to have. I haven't carried it this time, but sometimes you might want to put something in there that might settle your stomach for things like, you know, sickness and diarrhea, food poisoning. So you might put something in there that can help that. I haven't for this country, but when I have travelled further overseas, maybe Thailand or some other third world countries, I have actually packed that because it has actually settled my stomach. But this time I have actually packed, which I don't normally, would be the lateral flow testing kits, just so I can check to make sure everything is okay if it did start to feel unwell. But I suppose the most important bit of advice I'll say is make sure you know where to go and get help in the country that you're visiting. You know, maybe the chemist can help you, and find out where the local doctors is, find out where the hospital is, and what number do you actually need to use to call in an emergency situation. So I hope you manage to get away maybe this October half term, and you manage to enjoy some sunshine like I am right now. But if not, maybe just save these ideas for next year or next time you do go away. Don't forget to hit subscribe to our YouTube channel so you don't miss out on any videos. Take care guys, keep safe, keep well.